welcome everyone. Welcome to our latest podcast, Dr. Bell, Dr. Terrezza. I'm excited today. I tell you, it's a long time making. We've been wanting to update our website. A lot of people involved to make it happen. Certainly we've had patients weigh in on things that they would like to see. We try to make it more user-friendly, and we certainly have it up and running. I believe it's been up for about a month now, and we're going to go through a lot of those features that are on the website. And any questions you have that are not there, but we have multiple offices which we're going to get into, and the locations are all listed, providers are listed, but we want to kind of dive into it as far as services we provide, what might be available at one office versus the other, that sort of thing.
I agree. We put a lot of preparation, a lot of time into this website, and I think it shows it. And hopefully it's very easy for you to use.
Well, I think right off the bat, the first thing I notice is, the older website, you may have one picture here or there, a lot of wording, but this, we've got it incorporated where we can incorporate our podcast, videos, social media. Let's say when we want to teach a patient how to do insertion removal with contact lenses, or maybe things to expect when they get their progressives as far as adaptation, we can kind of put all those videos, anything we want to link to that website for the patients for easy access. So that's exciting. But going through, certainly services is one of the menus at the top if you click on that, and that kind of goes through basically what you can expect that we provide. Certainly we do full comprehensive exams. We do pediatric exams, geriatric exams. We do all sort of contact lens fittings, whether it's just regular soft lens, multifocal, RGPs, hybrid, keratoconus, pretty much sclerals, that's the big one nowadays. Pretty much anything you could expect with contact lenses we do.
Myopia management too.
Yep, we do that as well. And that is becoming key nowadays with the increase with kids becoming more nearsighted at an earlier age. A lot of people will say some of that's due to cell phone use, maybe at an early age, but certainly there's a lot of issues you can have if you become very, very nearsighted as far as the retina, and we're trying to limit that or at least decrease the probability of it.
One of the ironies or paradoxes of having a primary care general practice like we run is that there have been so many branches due to increases in technology, mainly, that it's very hard to keep up with that. And our having 12 optometrists with us, we have different docs that like the sort of thing that's particularly that maybe some of us don't keep up with. So we have a lot of these capabilities that maybe other places don't have on the general basis.
Yeah, I think that's one of the great things about having a group like we are is, we all do primary care exams, but like you said, we all have kind of maybe a specialty or something we kind of maybe do a little bit better or been trained a little bit better in, whether it's contacts or whether it's ocular disease or glaucoma or diabetic retinopathy, and we can certainly refer patients to that particular doc who does more of that, just that so the patient can feel secure, whether it's with us or in our facility, we're going to take care of them the best we can. The only other services I mentioned, all the exams, but also just office visits. So, whether it's a red eye, whether it's a painful, sometimes with thyroid eye disease, eye trauma, especially coming up, with the holidays, maybe the 4th and stuff. So we're always going to try to work in patients. We leave spots open same day, depending on the severity and kind of what we're looking at, we can get you in the same day, and if not the same day, certainly within a few days. So, we may be booked out as far as full exams, but we try our best to get patients in as soon as we can if they do have an issue like that as far as an office.
A good example of that is thyroid eye disease. It's very underdiagnosed and unfortunately misdiagnosed. And we have capabilities with that with our dry eye clinic to address some of the problems that come out with that, and all the options that are, it's almost a list. It's crazy, the number of drugs and the number of procedures now that have been developed for dry eye, some specifically for thyroid eye disease, but some for Graves' disease and people on antidepressants who have dry eye symptoms, and the list goes on and on.
Well, I know since I graduated school, kind of fast forward to now, those are big advancements for me that I've seen as far as macular degeneration, how we treat D patients now versus 20 years ago. Dry eye patients, there's a big advancements. We figure out exactly what's causing it, better treat them, better results. But I think everybody's more familiar with it. So patients that are going to go in and have maybe LASIK procedure or cataract surgery, we pre-treat them nowadays before the surgery. That way the outcomes are better and they don't have to worry about those things.
Just about any disease you can name. The earlier you catch it, the better off you are, and the more successful the treatment. So we now have, for instance, at the Palafox and Milton office, we have virtual reality testing for detecting macular degeneration 2 years before you can see it. And that's the #1 cause of blindness in people over 55. So this is a big advantage. And it's nice to know you have something the earlier you know it.
Especially when there's family history of it. Hey, mom had it, my brother has it, and you're worried about it, and we want to watch it, monitor it, and then at the first sign of any issues, we can let you know and treat you versus finding out 5 years or 10 years later. It's always good to know. Going through some more screens on here, we went through some of the services as far as that we offer pretty much at all of our locations. As far as products, we added that, which basically we got questions a lot from patients as far as like, hey, if I go downtown to Palafox or if I go to Milton, what frames do they have? Because we have a wide range of brand name frames, whether it's sunglasses or regular frames, and not each office has the exact same brand. So if you're looking for a certain brand, it kind of tells you what we have and what location carries that brand. As far as contact lenses go, I think it's safe to say any office we have, we can get any contact lens we need. So I don't think they'd have to go to any particular office. Maybe the only exception would be the myopic control or myopic regression. That might be the only one where we have that at a few offices.
Yes.
But as far as specialty fit contacts, RGPs, hybrids, sclerals, we do that pretty much at all the locations. Now, going through locations, do you want to kind of start that and kind of maybe go through the, I think that would help us to kind of go through where we started, maybe our base 4 locations, and then going through some of the newer locations?
Sure. The practice started in Milton in 1975, and we're still at that same location. In fact, we've added twice onto the building and now have 2.5 doctors there, 2 doctors there full-time 5 days a week, and 1 doctor comes in for specialty exams. It's not hard to find. It's on Stewart Street. There's only 2 major really highway streets in Milton, Highway 90 and Stewart Street, which is perpendicular to Highway 90. So you can't, it's hard to miss. And there's a big sign in front too.
And Milton is growing. I mean, I would say in the last seems like the last 5 years, Santa Rosa County, especially Milton, is a lot more people are moving there.
It's had the highest growth of any of the offices. So we're glad to see you there. The second office was at Palafox, across from the Sanger Theater. Been there since 1980. And that was more so in terms of sunglass selections, they're huge there for the tourist business that comes downtown for the nightlife and for the day life, really. And so downtown Pensacola's really developed over the last 10 years. And our frame selection there is classic and usually upscale to suit that clientele. In addition, we have all the regular insurances. In fact, there's only 2 insurances that we do not take, and 1 has been discontinued in the area. But other than that, we take it and we file it for you. And the insurance department, consisting of 5 people, sit there and process those claims all day, full time.
So if there's any question on whether you have a certain vision or medical insurance, like he was saying, we take 98, 99% of every vision medical insurance that's out there. But if you don't know, or you're concerned, or you can certainly give us a call. All of our staff, our billing department certainly helps us. We can look up and see what insurance you have, whether we take it, and then we kind of help you with copays, what to expect to pay, what you're allowable, all that stuff. We kind of break it down. But a lot of patients will say, hey, I don't have vision insurance, I can't come see you guys. But we do take most medical insurances too. So if we find a medical diagnosis, we can certainly bill your medical insurance. So went through Milton, we went to Palafox, and what's the next one after Palafox?
The corner of Fairfield and Lillian Highway. That is across from the CVS and across the street from the mall there. And we've been there, 20-something years now too. And that one is full service and also has 2 docs there full-time, 5 days a week, and capable of taking any insurance again. And we do a lot of walk-in medical type visits at that office too. I guess after that would be our newer locations, which would be 9 Mile Road. You can speak.
Yeah. 9 Mile, I think everybody, especially up that way, it's, around Navy Fed, it just keeps expanding on West 9 Mile. So we're at the corner of Beulah and 9 Mile Road, which is Beulah Crossing, the new Publix out there. And we've actually been there, believe it or not, almost 3.5 years. It's crazy how time flies, but we're doing really well. Certainly, not only catching that side of Florida and the Panhandle and Pensacola, but we're really close to Seminole, Robertsdale, Alabama too, as far as patients kind of driving in from that side. It's pretty quick to come in on 90 that way and get in. So
we take those Alabama insurances too.
We sure do. Yep. We got a good selection out there, and we'd love to see you at that office. And so, going from there, we've got. If we just skip over to Alabama for a little bit, you've had an office in Foley for a good while.
About 15 years,
Yep.
Yeah. Right there on McKenzie Street, opposite the city park. You can't miss it.
And then the newer one in Alabama is Fairhope, which is at the Publix there. There's a couple Publixes in Fairhope, but the older Publix in Fairhope right there, I think it's Parker Road right there.
That's right.
That's north of us, but we're right there. And it's kind of a side street kind of feeding into that Publix.
Yeah, that one we opened in November of 2024.
So those are the 2 in Alabama, and then kind of going, we just, Baptist Hospital, which moved from the old location to the new location now on kind of Brent there and I-10 right there at the hospital. We're in the Henderson building, which is right beside the hospital on the first floor, right beside the Starbucks. If you walk in that Henderson building on the first floor, you can't miss us, because we have kind of our medical facility where we do the exams, and then diagonal from that we have our optical, carrying all the frames, and you can bring in outside RXs if you want to just get glasses, sunglasses. We do prescription, non-prescription sunglasses, anything that you need we have in that optical, and we kind of did it separately for that purpose, to have the medical side and then the retail side. If patients just want to walk in without having to get an exam, they can certainly do that in the optical at Baptist.
It's nice to give them those options, which you always have at our office.
And so Baptist, and then going to our newest location, which is in Navarre. We've been wanting to get into Navarre for a good while here, and we're happy to be there. And I started actually in this area working in Navarre probably 13 or 14 years ago. But great area, certainly growing. We're basically right on the Navarre Parkway. It used to be an old Dollar General. We kind of basically just took over that building right beside Harvest Village, right there. But any of these locations, you can go to TerrezzaOptical.com, and basically it'll break down the locations of where we're at. But even if you don't know, if you just, you're new to the area, and let's say, hey, I don't know which one I'm closest to, if you just call, we can figure that out and say, hey, we'd be glad to see you at this location, but just so you know, this one's a little closer. But there's some, depending on where you live, depending on where you work and where you're going every day, you may prefer one versus the other. But all of our locations are on the same EMR software. All of us are linked. So there's plenty of patients that sometimes, maybe 2 years ago, I saw them at this location, but now maybe they've moved to 9 Mile and I see them out there. And so our computer system is set up that way where, you know, wherever we're at, we can access and see the same information that we saw years ago.
We even have the phones linked. If you call one office, they can just transfer you to wherever you need. That includes the Alabama locations.
And we have, you know, certainly, how many providers we got now? We got 12 optometrists. So certainly if you call up and you say, hey, I prefer to see this provider, and that's one of the things we ask, because we always want patients to see who they want to see. Some will say, hey, I prefer to see this provider or the other provider. Some will say, hey, I just can only come on Mondays. You know, so it's up to you kind of what location you want to go and what provider you want to see. But certainly we would love to see you at any of the offices. You know, whether it's just an office visit, whether it's a full exam, you know, whether it's a contact lens issue, anything that you have eye related, we would love to have you. And I even have patients come in sometimes just for consults or second opinions that, you know, maybe we're told this or maybe they want to recheck that, and we do, you know, whatever we need to do to help those patients out.
Absolutely. And one of our docs is fluent in Spanish, and he's retired Air Force, so he hits it off pretty well with the Navarre crowd, which is mostly an Air Force area due to Eglin Air Force Base.
Yep, I mean, and certainly, you know, we have ways. So if you need a translator, certainly in that area we have somebody with Spanish, but even other languages, we can do what we need to do to get you seen and to communicate the way we need to communicate and to answer any concerns or questions that you have. We went through on the page, went through services, products, locations, which we just talked about, the offices. Resources is pretty cool, and basically that's part of our media, you know, so part of our podcast. But we also have a question page, like the most commonly asked questions. You know, maybe you're wondering if we do this or if we do that, or you know, what happens after this. And so we're always adding new stuff to the pages there to try to answer questions that patients have. Certainly if it's a common question that we get quite a bit, we're trying to add that to the website so they have access to that. But of course we can't answer every question that's out there. So, you know, we'd be happy, you know, if there's something that you have that's not there, you know, go to our website, TerrezzaOptical.com, give us a call. We would love to answer any questions you have. I think we would agree, we're both blessed with great staff, and some of our staff have been with us for years and years, whether it's the tech, whether it's the billing department, front desk. We have people that work with us that not only are great people, but they really love what they do, and that shows. I hear that quite a bit from patients where the staff, they say this, you know, I've never been treated this well, or your staff is very knowledgeable, and I'm very happy and very thankful for our staff.
Well, I think that's a function of our investing in our people, which we take very seriously, and we do a good job at that.
So again, we're going through our website, just updated about a month ago, a lot of new stuff on there, so certainly check it out. Anything you need should be there. Any questions you have, you can look through the website, but also you can call any of the office locations. And just we appreciate you watching our podcast, and certainly any topics that we haven't covered, and we're going to try to link a lot of topics that we have to our website there. But you know, certainly there's going to be new ones that are coming out. We appreciate it, and we'll be seeing you at some point, hopefully. Thank you.